Learn all the relevant medical information about hypertension or high blood pressure in this video. High blood pressure or hypertension, sometimes described as the silent killer because it rarely has noticeable symptoms. The only way to find out if your blood pressure is high is to have your blood pressure checked. What is blood pressure? Two numbers record blood pressure. The higher or top number called systolic blood pressure, and it refers to the force at which your heart pumps blood around your body. The lower or bottom number called diastolic blood pressure, and it refers to the resistance to the blood flow in the blood vessels in between heartbeats. Both numbers measured in millimeters of mercury. How to read blood pressure. The ideal blood pressure is when the diastolic pressure is less than 80 millimeters mercury and the systolic pressure is less than 120 millimeters mercury. A normal blood pressure range is between 80 and 84 millimeters mercury for the diastolic pressure and between 120 and 129 millimeters mercury for the systolic pressure. This is a high normal blood pressure range if the systolic pressure is between 130 and 139 millimeters mercury and the diastolic pressure is between 85 and 89 millimeters mercury. Grade 1 hypertension, defined as systolic pressure between 140 and 159 millimeters of mercury and diastolic pressure between 90 and 99 millimeters of mercury. Grade 2 hypertension, defined as having systolic pressure between 160 and 179 millimeters mercury and diastolic pressure between 100 and 109 millimeters mercury. Grade 3 hypertension is defined as systolic pressure of 180 millimeters mercury or higher and diastolic pressure of 110 millimeters mercury or higher. If an individual has hypertension, he has an increase in both systolic and diastolic blood pressures. If systolic blood pressure rises but diastolic blood pressure stays within an acceptable range, this condition is called isolated systolic hypertension. This type of hypertension is the most common type of hypertension in people older than age 65. If diastolic blood pressure rises, but systolic blood pressure stays within an acceptable range, this condition is called isolated diastolic hypertension. What are the risks of hypertension? Your blood vessels, heart, and other organs like the brain, kidneys, and eyes are all put under additional stress if your blood pressure is too high. A number of serious and possibly fatal medical conditions, including heart disease, heart attacks, heart failure, cerebrovascular strokes, peripheral arterial disease, aortic aneurysm, kidney disease, ocular disease, and vascular dementia, are made more likely by persistently high blood pressure. What are the causes of hypertension? Hypertension may be primary or secondary. In as many as 95% of hypertension cases, the underlying cause cannot be found. This type of high blood pressure is called essential or primary hypertension and is greatly influenced by diet and lifestyle. Secondary hypertension is the term used to describe the disease when a direct cause of high blood pressure can be determined. Kidney illness is the most common cause of secondary hypertension. Adrenal gland tumors, pregnancy, and blood vessel constricting drugs can also cause hypertension. What are the risk factors for hypertension? Smoking, drinking excessively, being obese, becoming older, using birth control pills while a woman, and consuming an excessive amount of fatty and salty meals are all factors that can increase your risk of developing high blood pressure. How to treat hypertension? Your doctor can prescribe medication and suggest lifestyle adjustments to help you maintain a safe blood pressure level. Avoiding salty and fatty meals, quitting smoking and alcohol abuse, engaging in regular exercise, and decreasing weight if you're obese are all necessary lifestyle modifications. In a different video, common blood pressure medications will be covered. They include ACE inhibitors, calcium channel blockers, beta blockers, alpha blockers, angiotensin II receptor antagonists, and diuretics. In the end, if you liked this video, do not forget to subscribe to the channel and activate the bell button to receive all new updates. Goodbye.